The Covid-19 vaccine is not the only vaccine that's out there. So the vast majority of people have had all of their childhood immunizations.
There's been a lot of like propaganda around, is this something against, for example, black people?
We need to be compassionate towards people's feelings.
Yeah.
At the same time, we know that a lot of black people actually work in labs. We have a lot of black scientists out there.
Vaccine passports.
Yes.
Is there an agenda to get this thing in everyone's bodies?
Well, I mean, I think
With
countries
the passports, yeah.
have an agenda of trying to keep the people in their country safe, trying to protect their economy, trying to protect the infrastructure of their healthcare system.
Such a good answer.
Yes, I think.
Hi guys, welcome to the Mo Chunk Show and welcome to another installment of Chit Chat with Mo, where we have controversial debates, honest conversation and so much more. And as you can see, we have a guest on the show today. We have Dr. Gabi in the building.
Thank you for having me,
Thank you
Mo.
so much for joining us. Some of you may or may not know that I have a degree in medical physiology.
Oh, wow.
So I actually have a science background before I switched over to media. And you know, you're a doctor. So I'm really excited to have this conversation with you. And vaccines have definitely like fascinated me, how they've been put together throughout this pandemic. And it's been a lot on family, friends, so many things have been shut down. And eventually we had this breakthrough in science. The COVID-19 vaccine came out, and that basically like opened up a can of worms. You would expect that everybody would be happy that this is the thing that might get the world back to normal again. But actually we've had different theories about how dangerous the vaccine is, whether or not you need it as a young person, whether or not it affects things like fertility, young people's menstrual cycles. So we're just going to try and, in this conversation, hopefully break down some of those myths and also create some actual factual, evidence-based
Discussion.
Discussion for you guys. Yeah, that's what I'm trying to say.
Yeah.
Well, without further ado, a good question to ask is, are you pro or against vaccines? Because, you'd assume that healthcare, personnel, that you would be pro, but there's actually been a few that are like, nah, this isn't it.
Yeah.
So are you pro or against?
This is a good question. The COVID-19 vaccine is not the only vaccine that's out there. So the vast majority of people have had all of their childhood immunizations. So this is the immunization against measles, mumps, rubella, immunization against diphtheria, tetanus. Tetanus is a terrible disease that we don't really see right anymore, where, you can freeze up. So I'm definitely pro-vaccination because vaccines have been able to kind of eradicate really terrible diseases from populations. So I'm pro-vaccination.
Specifically the COVID-19 vaccine, were you in any way, shape or form skeptical?
Yeah. So I'm going to be honest. Okay. I had like my medical hat on, and then I had, doctors are humans as well, my human female hat on as well. When the vaccine first came out, I knew that nothing would be approved that wasn't safe. Right. But I had like this niggling feeling that I didn't want to get it. Yeah. And I couldn't put my finger on why. I just had this sensation that I wanted to wait and see what happened. Yeah. So when the vaccine was actually first offered for me, I didn't go for it. This was around like January time. Okay. And then I just kind of thought about things really logically, and I said, okay, my fears are telling me one thing, but let me look at things logically. Right. Have I ever heard of any vaccine ever making women infertile? Right. No, I've not heard of one. Have I heard of any vaccine causing a lot of problems? No. Have I seen a lot of people get very sick with COVID? Yes. Am I working in an environment where I'm exposed to COVID? Yes. Have I seen a lot of long-term complications of people getting COVID? Yes. So when I thought about all of this logically, I thought, what am I waiting for? Like, I need it yesterday. I'm going to get this vaccination. And when I took it, I felt like a big sigh of relief. I felt like, you know, I've done the right thing. I have that kind of level of protection and I didn't feel so fearful. Obviously, it's important to follow all the instructions, social distancing, washing hands, alcohol gel, using masks as directed.
Yeah.
But yeah, I'm really happy that I took that decision.
That's good.
I think a lot of people just don't have all of the information that they need to make an informed decision, or, you know, there's peer pressure going on.
And then couple that with the misinformation that's been spread around. You know, you don't have the right information and then you're getting misinformation. Yeah. And it's like you're trying to make a safe decision for yourself. Ultimately, I understand why it's hard to decide, you know, actually I'm going to go for this. Yeah,
because it is an individual decision and people shouldn't feel pressurized to get vaccinated or to not get vaccinated. It's really just about sitting down, looking at all of the facts and then making the best decision for yourself. And for me, that was to get vaccinated, and the vast majority of people will come to that same conclusion. Yeah. This whole pandemic, I'm going to be honest, I'm so fed up of it. Yeah. Because
let's talk about it. Like,
it's gone on way longer than anybody could possibly imagine. It's the first time in my lifetime I've ever experienced anything like it. But our only way out is to make sure that we reach a really high level of immunization. Yeah. Not just in the UK, but across the world. Okay. So that it doesn't have anywhere else to go. Yeah. And we really don't want any new variants, because if we're having high levels of transmission, the biology says it will eventually mutate.
See, there's so much to unpack from that sentence, right? So we're gonna take it slow, you know, because obviously you're a doctor, medical personnel, you understand everything you're saying, but some people might not quite get that. Yeah. So one word you've mentioned that I think we need to unpack is immunization, and also population immunization. Can you break that down for us? What does that mean? Why is it that a higher amount of people have to take the vaccine? Why can't just half of the population be vaccinated and that will be it, COVID will go? Yeah.
So individual immunization gives somebody a level of protection against a certain disease, okay? Because what happens with immunization is that it primes the body and it primes the immune system to be able to recognize that baddie, so that if it is exposed to the body, the body can quickly just get rid of it. So that's what immunization is about. The reason why we need to reach high levels of what we call population immunization is because we want to starve this virus out. So we want so many people to have really strong badges of protection against it, so it doesn't really have anywhere to go. Okay. Yeah. The reason why we don't want the virus to be able to go anywhere is because the more it spreads, the more times the virus replicates in somebody's body, the more chance there is for dodgy copies to be made. Yes. But the thing with dodgy copies is you may have some copies of the virus that are dodgy that don't live very long, and you may have a freak mutation that makes it really, really strong to actually evade the immune system that we've primed it for.
Yes, and that's something about viruses, isn't it? That viruses, they mutate
very quickly.
And they replicate very, so you're getting different colonies just showing up and popping up, different variants. And now we've got the Delta variant as well. I think, is there another one popping up somewhere else?
There is like the Alpha, the Beta variant, the Delta variant. They correlate to the different countries they were first found in. I don't think there's any that I'm aware for us to be worried about. But the good thing about the UK is that they've put a lot of money in to kind of testing the COVID viruses in this country, so that if there is a new variant, we can pick it up quite quickly. So we have quite good technology here.
Oh, that's amazing. Yeah. And you know, speaking of like money and tech and stuff going on, you know, a lot of people have been worried about why is it that this vaccine was so quick to make? Yeah. COVID happened. A year later, we have a vaccine where we have things like cancer, HIV that have been around for a very long time. Yes, we are seeing breakthrough in HIV, and that makes me so happy because, you know, there was a whole pandemic, especially within the Black community of HIV, and I'm so glad to see that, you know, our brothers and sisters that have HIV are living longer now. But that still hasn't been completely eradicated. So a lot of people are like comparing and contrasting that in the sense of this has been around for so long and we haven't quite seen the cure or found a level of immunization, whereas COVID only around for a year and a bit, and all of a sudden there's this magic potion. So why is that?
So I think the question should be changed, not to why did we manage to get a COVID vaccine so quickly? The question should be, why have we not been able to get vaccinations for other diseases in such a long time? The reason why we managed to get this vaccine approved so quickly is because a lot of different phases of clinical trials that usually take several years to push through because of money, or lack of money. A lot of money was thrown at the development of the COVID vaccine. So the whole process was basically done quicker because the different phases, you didn't have to wait years and years to get approval. So that's why it's not that they haven't done all of the phases or that they've jumped hoops. It's just that the money was there. The worldwide support was there to get everything done in a timely fashion. And me personally, I would like to see the same sort of energy, the same sort of finances put towards other diseases that, some people may say, okay, certain diseases only affect certain groups of people, but COVID affected everybody, so it was in everybody's interest.
And then it was like, we got the money, we got the funding, we got the backing of like scientific bodies as well, where ordinarily they might not respond to like research and replicate it in time. There was this sense of urgency, definitely worldwide urgency, you know, and there's been a lot of like propaganda around, is this something against, for example, Black people? I'm a Black person, you're a Black person, and I'm sure many people have had those fears, so I think it's important for us to have that discussion as well. In a sense of, is this, could the vaccine be something against Black people? Is it something to try to get rid of the Black community? What are your thoughts on that?
So I think the way that we use language is very important. So talking about, vaccine hesitancy amongst the Black community, I don't think is helpful, because we have to understand that we're living in a world that has been colonized. The majority of Africa was colonized, and colonization does actually affect the way that people, especially Black people, relate to healthcare services in the UK today. So we have to remember that. And
colonization goes deep, so many things that are prevalent within our communities today. You can almost link every single thing back to slavery, colonization, and like how we've, can I say developed? Like a lot of African countries are still very underdeveloped because, of the stain of colonization. So please, go on. That's a very good point to make.
We have to be mindful of this. We have to be compassionate about this. We had the whole Windrush scandal thing.
Very recently as well.
We need to be compassionate towards people's feelings. At the same time, we know that a lot of Black people actually work in labs. We have a lot of Black scientists out there who are doing groundbreaking work and were involved in the whole process of the clinical trials and the steps taken to approve this vaccine. And then finally, just thinking about things logically, when you go to the vaccination center, they don't know who's going to be next in the line to have the vaccination. So they're not going to be able to choose one vaccine for a Black person and one vaccine for someone of a different color. Everybody is getting the same vaccine that is suitable for them. And I felt really reassured that when I went there, I was able to say, can I see the bottle? Can I see the expiry date? I want to know exactly what is going into my body. And they were really nice.
That's very true, because I got my vaccine recently. I got my first dose 3 weeks ago.
Fantastic.
So I'm just waiting that 8-week gap that they've recommended to get my second one. I can't wait. I was a bit hesitant myself, mainly because of the propaganda around, or the theories around, infertility. So I was very happy for my mom, who's 54, to get the vaccine. She's had all her babies. Very happy for my brother to get the vaccine. He's a healthcare worker as well. Exposed to it on a day-to-day basis, and he's a guy. He's not going to be having any babies. When it came to myself, as much as I've been screaming about the science and the fact that I trust science, there was this seemingly discrepancy surrounding women and their reproductive health. I didn't think there was enough response from the scientific community to assure me. So I did go in with that hesitancy, but I went in with a lot of prayer, like I'm a person of faith. And I said, to me, it's for the greater good, and in a sense of, for me, the benefits of population immunization. How did we say that? What was the word about when everyone's...
we were speaking about a good level of population immunization.
For me, that far outweighs side effects. And I'm not just talking about the infertility thing. Like we've seen loads of videos. There's this video about, tremors recently. I don't know if you've seen that.
I haven't seen it.
A lady posted on Instagram. She had this Pfizer jab, the same one I got. And she had been shaken since then. And apparently it's a neurological disease that she's gotten. And her family believe it's because of the Pfizer vaccine. And, that scared me. I literally saw that the night before my vaccine, which is why I had to go in with a lot of prayer. I read some articles about the fertility thing. You can tell me if this is wrong or right, but I found out that actually we have some immune cells in our uterus.
Yeah.
And that might be why, some people have been seeing periods being affected, for example. That doesn't necessarily mean it's going to affect your fertility. It's only like a temporary immune response being triggered. And then when I saw the tremors, I was like, oh my goodness, like I've just gotten over the fertility theories because I read about and, found out, okay, that's been debunked. Now I'm seeing tremors. And in that moment, I had to be like, okay, for me, again, the benefits of all of us. And it's not like they didn't say there would be side effects. Like the scientists from the beginning have said there will be some people that will be affected, side effects from the vaccine, some mild side effects, some adverse side effects. So that was what kind of gave me the confidence to go through. But thankfully I did it. And like maybe a week later, a doctor came out and debunked the tremors as well and said basically it's neurological, that has nothing to do with the immune system, that has nothing to do with the mRNA that's within the vaccine. All that's happened is sometimes trauma happens and it's the way our brain reacts to that trauma that's creating the tremors. So it wasn't a direct, that famous phrase that you're a science person, correlation does not equal causation. And I think that's where a lot of people have been getting themselves in a muddle, in a sense of they've seen certain things online and said, right, the vaccine's causing that, we told you. So what's kind of your thoughts on the side effects and the theories? What are the side effects that, they've said that we might have, number one? And then what are your thoughts on some of the theories about some of the adverse side effects that we're seeing some people post-vaccine? We're not saying it directly, it's been directly caused by the vaccine, but post-vaccination, they've seen certain things change about their bodies.
Okay. So like common side effects that we expect people to have. So feeling like they've got a little bit of a flu-like illness after the vaccine, feeling tired on the day of vaccination, maybe feeling a bit warm on the day of vaccination, ache around the arm area where you've been vaccinated. These are all side effects that we expect. And they're even side effects that we should embrace happily because it shows that the vaccine is working.
It's working. It's in your body.
It's priming your immune system. Your immune system is getting ready for any, potential fight. When I had the vaccine, I did have side effects and I was quite happy to have them because I knew it was working.
I slept like a baby that day. Literally.
I was very tired. I did actually have a side effect that not that many people I know had. So I had like this horrible nausea and I felt like I was going to vomit. And I was driving home, so I actually had to pull over and just sit calmly for half an hour.
Wow.
I didn't vomit, but it was a strange sensation. But that passed after like an hour or so. And I'm really happy that, the vaccine was working for me. In terms of, rarer side effects, for example, it's quite reassuring that if we are seeing a pattern, it's not something that is going to be brushed under the carpet. So we saw the whole thing with the blood clots, right? That was talked about in the media quite quickly.
What was the whole thing with the blood clots?
So what they found with the blood clots is that with certain types of vaccination, younger people can be at a slightly higher risk of developing blood clots. Okay. Still, it's a very, very, very small risk. But it's good that the healthcare services are not willing to put people at that small risk. And so what they said was for younger people, we're not going to give them that vaccine. We're going to offer them a different vaccine that doesn't come with that risk.
So the science does care. I think there is this thing going around that they don't care what happens to us post vaccination. And it's like there's this very delicate monitoring system that's been happening on the science side.
We are monitoring things, and there is actually a national monitoring system called the yellow card system. So anybody can actually report side effects to the COVID vaccine on that website, and hopefully we can put it in the sort of description so that people can know where it is. But for the COVID vaccination or any medicine that you take, if you have a side effect, you can report it on this national system. And all doctors know about this. So if I'm seeing anybody who says, oh, I've got a particularly sore arm or anything, I will say, make sure you report it on the system so that we're able to gather data, so that if we are seeing any patterns, the scientists can look into it.
Beyond the blood clots, has there been any other side effects that, they're noting down, okay?
Yeah, I think they've noticed a possible pattern, but it's not been confirmed if it is a side effect. As many women have reported changes in their menstrual cycle after the vaccination, but they haven't been able to say, look, this is cause and effect. We know that many different things can affect people's cycles, stress. The whole situation of the pandemic is extremely stressful. And a lot of women of childbearing age do have variations in their cycle as well, but they are sort of collecting information on this. And if they do notice that there is definitely a link and people need to be made aware, they will do it.
I mean, I would say for me personally, my first period post, I've only had one period, haven't I? My period post vaccination, on the first day, I did feel a very sharp pain that I haven't felt since I was younger, since I was 15 when my periods, first started becoming more consistent. Apart from that though, very light. Finished as normal, and because I was moving around a lot, I barely felt any pain. But other than that, because I was quite worried, oh my gosh, my period, but really and truly nothing major happened. So I was quite, happy about that. But I think it's great that they're monitoring that. I think that's the great thing about that. So which vaccine was it that they were suspecting, under 40s were getting blood clots from?
Yes, it was the Oxford AstraZeneca vaccine that they found younger people may be at increased risk of clots. That vaccination is a very good vaccination. It was developed in the UK by our scientists. And also that vaccination is actually more cost effective than the other ones. So it's not that it's not a good vaccine. It's just that for certain groups, younger people, it's better for them to have a different type of vaccine.
So things like Pfizer. And is there another one? What's the other one?
So I think the Moderna vaccine as well.
Okay. Brilliant. In that case, what if you've had the first jab, the first dose, AstraZeneca? AstraZeneca, and then what next? So this is a very good question. This actually happened to my sister. So she'd had the first dose AstraZeneca vaccine, and in the end she did go and have the second dose, and she was fine. I think it definitely is something that is an individual thing. So if people find themselves in that decision, they do need to discuss their options with their healthcare provider, with the vaccination centre, and choose a step forward that's right for them. Is it wrong to mix vaccines?
So in terms of mixing vaccines, I'm not aware of any national guidance, but I know that there are trials out there where they're looking at mixing vaccines and seeing how things go. As I said, it's individuals. So I have heard of some people having mixed vaccines, but I cannot say that this is a national policy or that this is a protocol that has been approved. Again, I think it's a personal decision. Do you still go for the second dose, but discuss things with your provider? And I think it's been quite a while since the guidance changed, so there shouldn't really be anyone out there who's in this position anymore, because it's been several months since the guidance was out.
And ideally, what's a good time frame between first and second vaccine? Because I believe in the UK it's 8 weeks. But then we've had other countries doing it in a shorter time. So it's what is the truth? So
this has changed quite a lot, hasn't it? Because when the Pfizer vaccine first came out, they were saying 3 weeks for the second dose for Pfizer vaccine. And then the AstraZeneca vaccine, initially they said 12 weeks. And then they made a decision for the population and felt that it was better for a large majority of people to have their first dose. So people were having to wait 12 weeks for the Pfizer vaccine. But I think now what they found is that 8 weeks is the best time for people to have
an optimal
their second dose. I think the guidance is changing all the time for time length, and it depends which vaccine you've had. People shouldn't stress out too much about it. When they get vaccinated, they will be told when is the best time to have their second dose, as it may change tomorrow.
Yes. Yeah.
And they will get an alert when it's time to have the second dose, or they can go to, there's so many walk-in centers now.
I got a text saying, I got a text saying, you can book your vaccine earlier. So I booked mine a bit further down in September. They said I can push it up because of the time frame. So they are communicating.
Yeah.
I think that's one thing we should note in terms of, you know, time frame, which one's best for your age group. The information is out there. It's just a matter of finding it and accessing it. If in doubt, I would say speak to your GPs like, you know, Dr. Gabi.
I think, you know, there is so much information out there. And, you know, for people who haven't had their vaccine, you know, the information will find them, because, you know, GP practices are actively contacting different groups. I'm getting text messages saying, you know, walk in here, walk in there if you haven't had your vaccine. So it is really easy to get it. And what we've found actually is now that things are opening up, people can go on holiday. People are literally fighting to get jabbed before they go away.
And there's this whole like propaganda around the COVID vaccine passports.
Yes.
And a lot of people have been kicking up a fuss about, you know, why must I be jabbed up before I travel? This is a whole agenda to get this poison in my body. What are your thoughts on that? I mean, my initial thoughts is always like vaccine passports have existed since forever. Before you go to Africa, for example, you have to get jabbed up because of, you know, some of the potential threats that you're going to face over there. COVID is a global thing. It makes sense. At least to some of us. No shade. It makes sense to some of us that you would need to be jabbed up to just be traveling up and down. It's your safety and also the safety of those around you. But what are your thoughts on that? Is there an agenda to get this thing in everyone's bodies?
Well, I mean, I think countries have an agenda of trying to keep the people in their country safe, trying to protect their economy, trying to protect the infrastructure of their healthcare system.
Such a good answer.
So I think they do have an agenda. But when it comes to vaccine passports, there are several countries in Africa where you need to have the yellow fever vaccine to go. They will not allow you through the border when you arrive if you don't have that proof of vaccination. And I went abroad recently. So what I did, which was really useful and helpful, I downloaded the NHS app. That's not the same as the COVID-19 track and trace NHS app. It's just NHS app for like your GP surgery. When you go on the app, you will see that your COVID vaccination type, date and time will be on there. And then what you can do is download an official certificate that actually has a QR code. So you can't really fake these things. And what I did when I was traveling was I downloaded the app of the airline I was using so that I could submit all of my documents before getting to the airport. So that they could verify.
Very, like, quick and easy.
It's really robust and secure, and it gives me a sense of safety because I know that everyone who's getting on that flight, you know, they'll know who's had a test, who's not had a test, who's been vaccinated, etc.
And a lot of people have been seeing that as like a removal of, you know, rights. I mean, to an extent it is. Like, let's call a spade a spade. But again, I think it's that whole thing of you can choose what you want to do with your body. But it's hard to then decide how that affects everybody else or how you interact with everybody else. But I think something else that, you know, might be worth mentioning as well is pregnancy. And also breastfeeding.
Over 100,000 pregnant women have been vaccinated in the United States and no issues have been found.
Whilst pregnant,
And also, when they were doing the actual vaccine trials in America, they did give the vaccination to a number of women of childbearing age. And they said to them, look, we don't actually want you to get pregnant because, you know, we're seeing what happens. And despite that, a number of women did actually get pregnant, even though they were told not to.
You know, things happen.
It means their fertility was good, right? And they went on to have their babies, no issues, no problems.
Issues. So, and what about breastfeeding as well?
So it's not been found that there's any issue, any reason why breastfeeding women cannot be vaccinated. So happy mum equals happy baby.
Amen. There's been a lot of debate around what's actually in the vaccine. because of the mRNA, a lot of people have said, does this affect DNA?
Mm-hmm.
You know, there was so much like religious propaganda as well at the beginning of this whole thing. A lot of people thought they were putting 666 in their DNA. They were going to change and clone. Oh my goodness.
Yeah, I saw some videos and they almost got me as well. Like the videos are so...
And you're a doctor.
They're so convincing though. And the problem is that once you look at one of these videos, the algorithm of the platform you're using just sends you more of the same stuff.
Wow.
And then your sort of reality can become distorted because of what you're seeing
Constantly.
is out there.
Yeah. So does it affect DNA in any way, shape or form?
It does not affect DNA. It cannot alter your DNA in any way, shape
so
or form.
Why mRNA then?
The reason why mRNA is actually a really good thing to use for vaccination is because it's a messenger that's just a code for a protein. Okay. So the mRNA vaccines like the Pfizer vaccine, it's just a tiny bit of this code encapsulated in a little bit of like a lipid capsule, like a fat capsule. And it just tells the body to make the antibody for the spike protein that is on the outside of the virus. That's all it is.
Yeah. So it's nothing to do with DNA, people. It doesn't go into your system, alter who you are or what they want you to think or believe.
No, not at all.
That's a really great one to debunk. And also I think one that I think it's important to address is this whole thing about young people feeling invincible.
Yes.
I'm a young person, I'm fit, I'm healthy.
Yeah.
If I come across COVID, I'm going to be fine. My body will fight it. That's I believe, you know, the feeling a lot of people are having. And, you know, unfortunately, we are hearing stories of young people fit. I think I heard of a guy that used to like do the mountain climbing.
Yeah.
Like imagine someone like that in his 40s and got COVID, was in ICU and unfortunately passed.
Yeah.
So what do we say to those kind of people that believe they will be fine because of their age and their fitness level?
Yeah. I mean, what I would say is that unfortunately, you know, we are seeing that young people are being admitted to hospital now. So unvaccinated younger people are in hospital as we speak being treated, because if we have high levels of transmission, the number of people who are having bad outcomes is going to increase.
Right.
So
especially with the variants as well.
With the variants. So being young doesn't mean that you're invincible or that, you know, you're not at risk of serious illness. And what we're finding as well is that a lot of young people are ending up with long COVID. So they are not making a complete and quick recovery. They're going on to have, you know, long-term breathlessness, lethargy, things like that. And because it is a very new disease, the scientists are still trying to research what exactly is long COVID.
Yeah.
How do we investigate it? How do we treat it?
Yeah.
Because it's so new.
So far, how would you define long COVID?
So, I mean, people I've seen who have long COVID, every single one has been different. People are extremely tired. They're not able to go back to work. I've seen people who've had unusual, like abdominal symptoms after COVID, just all sorts of strange things.
Yes.
A lot of hair loss after COVID as well, because obviously the body is under an immense amount of stress. We can
in the
see
immune system.
So people shed a lot of hair. It's just an extremely stressful thing to put the body through. And when we have modern science, why not take advantage of it?
I think that's the main thing. Like COVID has unfortunately disrupted our lives, like whether we like it or not. It's affected everyone in some way, shape or form. Very sadly, people have lost family members. And like you said, long COVID, a lot of people are still dealing with some of the symptoms, you know, and, you know, the vaccine is here now. And we've been encouraged, like, please go and get your vaccine, regardless of your age, your gender. Last but certainly not the least, how can they book their vaccine? Like, who can access the vaccine now? And, you know, that's changed over time as well.
So easy to book your vaccine. You know, people can call the GP surgery that they're registered at, even if they're not registered with the GP or they don't have an NHS number. They can call 119 to book their vaccine. They can go to the NHS COVID vaccine website. There are also walk-in centres all over the country that people can go to. So if you just Google COVID vaccine walk-in centre on Google and type in your postcode, somewhere should come up. You know,
awesome.
They're vaccinating people in pharmacies. There are even like mobile units that are going to different places to reach communities. So it's super easy to sort of grab a vaccine.
Yes, awesome. Thank you so much, Dr. Gabi, for joining us today on today's episode. I really hope you guys at home found that conversation insightful, and hopefully you're encouraged to go out there, get vaccinated, get protected, protect yourself and also those around you. Where can we find you, Dr. Gabi?
Yes, so I'm quite active on social media.
Oh, great.
So you can find me on Instagram and also Twitter.
Yeah.
My handle is Dr. Gabi Official. So that's Dr. Gabi Official. And then also, obviously I'm an NHS doctor, but I've also started this brand new service called Maha, which is a holistic health service for women. So you can follow us on @Maha Official. That's MAHAAH.
Thank you so much, Dr. Gabi. What an amazing individual. Let's just give it up for Dr. Gabi wherever we are. Thank you so much. Thank you. Thank you so much for watching today's episode. If you liked it, share with your friends. Comment below. Has your mind changed about the vaccine throughout our conversation? Have you learned anything new? Are you still skeptical? What are your reasons for choosing to get the vaccine or to not get the vaccine? Let us know in the comment section down below. And until next time, guys, peace and love. Peace and chunks.